New research into the impact of long COVID on the brain shows sufferers experience memory loss and difficulty concentrating, similar to people with traumatic brain injuries and stroke. The Australian study has also identified a marker of brain impairment that could help accelerate treatments.
2 years after contracting COVID-19, Judy Lee continues to experience debilitating fatigue and brain fog.
Things that I used to know just doesn't come back to me, and even just words or trying to make a sentence, it's like the words on the tip of your tongue but you can't bring it forward.
The 38-year-old project manager has long COVID. It stopped her working and limits what she can do to care for her children.
So my partner's had to single parent for the better part of the last 2 years, and it's just been a really big struggle.
New research carried out at the Long COVID clinic at St Vincent's Hospital in Sydney has found around 20% of patients suffer memory loss and brain fog with no improvement 12 months on.
It is impactful on patients, and it's more impactful the more cognitively demanding your mental activity is in your profession.
The research also found that people suffering with long COVID didn't necessarily experience severe sickness with the virus when they had it. 9 out of 10 weren't hospitalised. The study identified a marker of cognitive impairment, a toxin in a particular pathway in the brain, which opens the possibility of repurposing existing drugs to treat the condition.
That's going to help us target treatments. We can use some drugs already off-label, and it means that people who come to our unit might be able to enter into research trials.
New South Wales Health estimates between 10 and 20% of people infected with COVID-19 will develop long COVID. Nationwide, around 1.4 million people are expected to get it.
It just sounds very promising that we've got a lead and something to try, and I think a lot of us just need some hope.
Changes to Victoria's pandemic orders will see masks no longer required at airports from 11:59 p.m. on Friday.
You still will be required to wear a mask doing air travel, but it's a proportionate, safe and considered response to the high vaccination rates we do have here in Victoria.
The states also lifted mandates that workers in most sectors get second or third doses of a COVID-19 vaccine, a move that's expected to ease supply chain pressures. Philippa Carisbrook, SBS World News.